Hello, hello. So today we're going to talk about good news. Yes, we need more good news. And my name is Peggy van de Plassche. If it's your first time here on the podcast, thank you for being here. And yes, I really wanted to focus on good news in healthcare because we always focus on what's not working. But it's a bit of a reminder to look for the light, to look for what's working and not just what is not working. And, I don't like to say things like that, but we do live in a world where it's easy and almost automatic actually to look for what's not working. We put our dark color glasses and we focus on what's not working. And healthcare doesn't escape this, unfortunately. And you can look at things, in the US, obviously, you've seen like the decrease of the life expectancy, you've seen the overturning of Roe versus Wade, which has placed women's reproductive right and overall health at risk. Obviously, you see structural cracks that have widened post-pandemic. The headlines, of course, can be very negative, and I'm not saying to ignore that. But if we look a little bit closer, we also see another story that is more quietly unfolding. And it's more a story of hope, of innovation, and of real progress, in human health. So I wanted to give a bit of that, just to have a chance to look at the bright side for once and what has been working. So one thing, as you might know, again, if you've been following me, I'm quite passionate about psychedelics really as a treatment for mental health. I think there's a lot of prospects in here, not just prospects, because a lot of that is already happening, but even more options for most of us in order to have better mental health. And I think that's very important. It is not just for people who suffer from, drastic problem. I think we could all benefit from a better mental health. So I think one of the most transformative trends in healthcare today is really this renewed exploration of psychedelics for mental health. And, at some point it was really dismissed as fringe. I think it was seen maybe a bit as woo-woo, but it's really entering right now mainstream clinical research. And I would say not right now, again, it was already the case in the 50s, 60s before it was unfortunately outlawed. So we think it's the first time we're going at it. It is not. There is actually a lot of data, as I mentioned. MDs were actually prescribing psychedelics before Nixon banned them. So I know we have more data now, but it is not brand new. So we see promising results right now for PTSD, which I think is so important, but also depression, anxiety, addiction, all these things our societies really are struggling with. And think about it, if we're able to decrease addiction, decrease PTSD, obviously depression, anxiety, but just focus on addiction. Can you imagine the different world we will see without that? So, and I wrote about this evolution in some of my newsletters, also on the podcast. One was called Investing in the Future of Health. The other one was called Investment Opportunity Inner State, which is the name of the company, and the Psychedelic Renaissance. So you can look at it and look at the trials from MAPS with MDMA for PTSD. Also, the fact that the FDA granted breakthrough therapy designation for psilocybin-based treatments. There is a lot of hope, and it's happening actually faster than many of us are realizing. So yes, it is not mainstream yet. Yes, it is not legal yet in many places in the world to do it yourself, but it is moving in that direction, and that is very positive. One thing I also want to talk about is this idea of early detection and the fact that early detection technologies, really can save lives. Obviously, the earlier we are to detect a disease like cancer, for example, well, the more chances we have of healing that person and healing of a disease that is less advanced. So in a better position, and a treatment that's going to be obviously less onerous for the patient. So cancer, obviously, it remains one of the greatest challenge of our humanity. But again, these recent advances in early detection are really changing how these outcomes might turn out. So there is new technology called liquid biopsy, multi-cancer early detection test. You can see next generation imaging, all of that are pushing the fact that we can diagnose earlier and really giving patients a fighting chance to survive, because obviously when you detect a cancer and it's already stage 4, wow, it's way more difficult to fight and to beat that it is stage 1. And I think that early detection is so important. So I also have a podcast where I was interviewing the CEO of a company that was focusing on early detection for ovarian cancer. And it's called The Future of Early Cancer Detection. You can find it in my in my playlist. So again, what is very important is that when the disease is caught earlier, the treatments are less invasive. So for sure, the survival rate increase, but also it is less invasive. And again, it is less expensive for the healthcare system. I always come back to prevention and promotion, but everything we can do before is going to cost us less money. Unfortunately, that is not how our healthcare system is built. But now, with the help of technology, this is getting possible. So hopefully, we're going to see a change from being at the end of a process and being earlier in that process. One of the things that is very interesting as well, we've been obviously talking about aging and how do we want to reimagine aging. And it's not just this idea of a longer life. You want a better life. It's about, the health span versus the lifespan. Health span is the number of years, we live with vitality and purpose. And I'm not talking about, like the biohacking and all this craziness you see from some of the tech bros. It's more looking at it from technology, so breakthroughs in cellular reprogramming, looking at senescence, so this zombie cells, targeting senescence, metabolic interventions, like all of that are giving us a future where aging could be treated, potentially reversed. From a spiritual perspective, I'm not sure where we want to go with that, but that's another question. You can listen to that interview with Marco Quarta in The Future of Aging, Can We Reverse the Clock? And it is a very, very interesting interview on how science is really, again, moving beyond this lifespan, but really going into this health span, which I think is way more interesting. What's the point of living a very long life if it's a very unhealthy and unpleasant life? So that could obviously reshape everything from personal well-being to healthcare economics as well. So that is very important. One thing that would be great is if actually aging was recognized as a disease. The second that classification happened, it opens up way more opportunities for research. We're not there yet, but that would be a potential move in the next decade or so. So one thing I also want to mention is women's health and the evolving landscape of women's health. And again, it's easy, unfortunately, with what I was discussing in the intro, to forget about the things that have been actually positive for women's wealth in the last decade. So it was only a decade ago. I know it is very recent. I know we can look at it from an infuriated perspective, but at least it has changed. It is only about a decade ago that the regulations formally require the inclusion of women in clinical trial. Yes, it was not the case before. And that, reflect finally the understanding from the medical establishment that women have a different biology and they need to be included. They were not included in the past because it was more complex, obviously, because you have more hormone challenges in women than you have in men, actually. And so that's why they were not automatically included. Actually, they were sometimes excluded on purpose to make the research easier. So that is very good news, actually, that women are now included in a clinical trial around the same time, so a decade ago as well. The FDA established the Office of Women's Health because by definition, health was looked at with a gender or men gender lens. So that the establishment of that office is really a critical step, really addressing gender-specific needs in healthcare, in policy, and innovation. Again, I think that's something that is happening finally. Of course, in a fairer world, it would have happened earlier. Better late than never. Hopefully, it's going to stay there, and the current administration is not going to remove that as well. But so far, so good. We see also a greater representation now of female across, I mentioned clinical research, but also diagnosis standards, treatment plans, even pain management protocols. And again, the journey towards full equity, is still ongoing, but we are in that direction after centuries of not even looking in that direction. So again, look at it from the right side. It is happening finally. You can see also that in the world of beauty and skincare, that, that world has broadened. Before, it was very difficult to find products that accounted for a diversity of skin tones and needs. And it was largely ignored, just, 20 years ago. And I think you can really see it as a more inclusive, better informed industry. So that is also very positive. One thing that I thought is very, very important for us to realize as well is we are seeing the dismantling of the stigmas around menopause, period, postpartum mental health, and more, these topics that they were hidden in silence for, again, centuries are increasingly brought to the forefront. And that really help reshape how medicine, how society, how policy approach women's well-being. And that is super, super important that we stop hiding this topic that were taboos for too long. And you see that as well with this idea of pushing women to do more strength training, this idea that building muscle and resilience, it's not a gender stereotypes anymore. It is really seen as this pillar of lifelong health and vitality. It's not just you're just doing cardio to be slim. You're doing strength training to be healthy, to be strong. And that in the last 10 years, the discourse has changed quite a bit, which I find is very positive. Whether you like to lift or not, that's a different conversation. But positioning it in that, with that lens, I think is super important. One other thing I want to mention is AI and preventive health. That is very front and center as well when you look at the progress and also the future of healthcare. It's really this idea of a new era of proactive care. Again, everything that is proactive, prevention, promotion, I think we can never do enough of that. We would be in such better situation, not just in healthcare, but as a society, if we were focusing more on prevention, promotion, being proactive versus always arriving at the end once problem has arrived. So generative AI, predictive health models really are revolutionizing not just how we treat the disease, but how we prevent it. And again, that's what we want. It's less costly in terms of obviously healthcare costs, but it's less costly on society. It's less costly on human lives, on family systems. So the better we are at preventing disease, the better our societies will be. So instead of really waiting for illness to manifest, new AI tools can help physicians spot risk earlier and intervene sooner. So you really, again, want to move healthcare from reactive to proactive. You can also look at another podcast that I covered that was in a podcast called How Generative AI and Preventive Health Are Shaping the Future. And again, so from predicting chronic disease to obviously optimize preventive care plan, AI is really helping making healthcare faster, smarter, more human, and cheaper. We always complain about healthcare costs. It's also because we manage healthcare upside down. We need to change the paradigm in the way we look at healthcare. And one of the last thing I want to mention, which is also based on tech and this innovations on the tech front, is it's about how healthcare is delivered. It's not just about more technology. It's about human-centered technology. Whether you're talking about remote monitoring, predictive analytics, AI-driven diagnostics, I spoke about that a bit earlier. All of that is designed to help the clinicians and the patients, and not to replace them. It's really a support. It's the machine, if you want to call it like that, the machine plus the person. It's really this hybrid model, 1 + 1 = 3, which I think is really the right way to approach it versus let's replace human by machine. I'm not really sure about that one. And you can again listen to another podcast on that where I discuss that shift, which is called Reimagining Health, a call for humanistic innovation. It's a very, Dr. Ziv is with me on that podcast. Very, very interesting. So again, slowly but surely, healthcare is becoming more personalized, more accessible, and more compassionate, which is something very important. So as a conclusion, you want to look at the world we are building. In the darkness, there is some light as well. And we're really standing at the edge of a profound transformation in healthcare where mental health is destigmatized, deadly diseases are caught earlier, women's health is better represented, aging is reimagined, and humanity really sits at the center of innovation. So I don't want us to lose sight of that. Again, we can always look at what is not working, and God knows there are plenty of things not working. I'm not saying that it is not the case, but there are also progress that is happening. There are also a lot of people who are passionate about making the healthcare system better. And I think we can also all do our part in that process. We can advocate better for ourselves. We can also focus on our own lifestyle, making them better in order to limit the risks after. That is our own responsibility. It is not the healthcare system responsibility or society's responsibility. It is in our hands. And I think it was an important message I wanted to share today, that there are a lot of great things that are happening already today in the healthcare system. So thank you so much for listening. Again, my name is Peggy van de Plassche. You can find more about me on the interweb. And I'm looking forward to seeing you soon. Please don't hesitate to reach out if you have questions, comments, and please share it with your friends and your family. I think these are conversations we need to have. The earlier, the better. Thank you very much and have a wonderful day. Bye-bye.